Welcome back, everyone. We're going to now talk about how to treat a new virus. So, how does one go from detecting a brand new disease to developing new life-saving drugs in such a rapid timescale? As we talked about in the first lecture, in December 2019, we saw the emergence of this pneumonia of unknown cause. And of course, what we'd like to do is develop treatments that can help people that are infected with SARS-CoV-2. So there's a few steps that you can think about in developing treatments for a new disease. And the first step is to identify the cause of the disease. And as we talked about in the first lecture, this happened really rapidly in less than 1 month. And so again, COVID-19 is caused by a virus called SARS-CoV-2. And this has a genetic code encoded by RNA, as well as the spike protein that it uses to get into cells by the ACE2 receptor that we talked about in lecture number 2. So the second step in developing treatments for a new disease is to understand the disease course. And so again, as we talked about in the second lecture, there's really a spectrum of how this disease progresses and whether the immune system is a friend or a foe. And so at the beginning of the disease progression, the immune system is really helping you. It's preventing the virus from replicating through the antiviral immune response. But as the disease progresses, if the virus isn't cleared, now the immune system becomes a foe. And so in this host inflammatory response phase, you have this cytokine storm that was mentioned in the previous lecture that actually causes damage to our own host cells. You can really think about these two phases of COVID-19, one in which the damage is caused by the virus itself, and the second one in which the damage is caused by the host response. And so these are also two phases in which we need to think about treating COVID-19. There are antiviral drugs that directly target the virus, and so we can learn about treating COVID-19 by learning from the virus itself. There are immunomodulatory drugs in which we learn from patients how to target the immune system to combat COVID-19 disease progression. So the third step in developing treatments for this new disease is to target steps that are critical and unique for the virus. The first step is the attachment of the virus and entry via the interaction between the spike protein and the ACE2 receptor. The second step is the replication of its genetic material inside of the host cell. The third step is the assembly of new virus particles on the outside of the host cell. And then the fourth step is the budding and release of these viruses that can then go on to infect other cells. And so there are different compounds that can target each of these different steps in the virus life cycle. So how might you block attachment and entry? Well, as we talked about in the previous lecture, the body generates antibodies against the spike protein that can then prevent the interaction between the spike protein and the ACE2 receptor and prevent the virus from even entering the cells to begin with. And so this sort of treatment is called monoclonal antibodies. And we can take antibodies that are generated against the spike protein and then give them to patients in order to prevent the virus from infecting cells. This is exactly one of the strategies that's been used as a treatment for COVID-19. What you can do is take antibodies from an infected patient who has immunity and then infuse these antibodies into an uninfected patient that will now be immune to the virus without having had to be infected themselves. The second critical step of the virus life cycle that we can target is viral replication that occurs inside of the cell. And so how can we do this without harming the host genetic material replication? It turns out that the virus has a specific RNA polymerase that it uses to replicate its genetic material, and there are small molecules that can specifically target this viral RNA polymerase while sparing our host RNA polymerases and DNA polymerases. And so how do you test a model like this? Now, SARS-CoV-2 doesn't infect mice. It's specific to humans. However, scientists have developed models in which they can implant human tissue into a mouse and then infect the mouse with SARS-CoV-2 in order to study drugs and whether they can prevent the virus infection. So this is a system in which we can use to test the efficacy of these different RNA polymerase inhibitors. One of these such small molecule drugs called EID2801 can inhibit the proliferation of the SARS-CoV-2 virus in this mouse model of infection. And this result is only 2 days after starting treatment with this drug. And so systems like this can allow scientists to test different drug candidates that will specifically target different aspects of the virus life cycle. As we mentioned, as the disease progresses, it's important to learn from patients to understand how to treat COVID-19. And so although the RNA detection rate is declining after the days of symptom onset, the disease severity is actually increasing. And this is, of course, due to this immunopathology caused by this cytokine storm. And so why does the virus get worse as the amount of virus decreases, and what does that mean in terms of how to begin to treat COVID-19 in these more severely infected patients? Again, there are these two different clinical phases of COVID-19, one in which damage is caused by the virus, the other one in which damage is caused by the host immune response. In the second phase of the disease, what we want to do is target the immune system itself using drugs called immune modulators to help patients that are infected with SARS-CoV-2 and are experiencing severe COVID-19 disease. This inflammatory storm, as was discussed in the second lecture, occurs when immune cells enter the lung and interfere with its normal functioning, and that's what leads to the difficulty breathing and this COVID-19 pneumonia. And so there are a number of drugs that can block the cytokines that trigger this inflammatory storm to treat COVID-19. So going back to what we talked about in the second lecture, there are cytokines produced by killer T cells, there are cytokines produced by the infected cells, by innate immune cells called macrophages, and there are different drugs that we can use to block each of these cytokines from interacting with their target cells and causing this inflammatory storm and lung dysfunction. Now, we can also treat the additional diseases that are associated with SARS-CoV-2 infection. As we talked about in lecture 2, this virus can infect lots of tissue throughout our body that express the ACE2 receptor. There are different treatments that we have that can help to address the dysfunction in these specific organs that can be affected by SARS-CoV-2. So to treat lung dysfunction, we have a ventilator that can help patients breathe artificially. SARS-CoV-2 can infect the gut and cause diarrhea, which can be treated with oral rehydration therapy. We can use immunosuppressive drugs to treat the heart inflammation that occurs when SARS-CoV-2 infects cells in the heart. And there's lots of ongoing research to understand how SARS-CoV-2 affects the nervous system to cause things like loss of smell and the brain fog that's associated with long COVID. And so as we begin to understand more about how the virus and the immune system interact with the nervous system, we can perhaps also develop treatments to combat the loss of smell and brain fog that occur as a result of COVID-19. To summarize this third lecture, it's really important in developing treatments for a new disease to understand the cause and spectrum of disease. And so in the case of COVID-19, there are these two phases in which we want to target the virus in the first phase and target the immune system in the second phase. Second, it's important to target critical steps of the virus life cycle that are unique to the virus so that we spare our own host cells. So these critical steps of the virus life cycle include its attachment and entry, its replication of its RNA genetic material, its assembly, and its budding and release to infect subsequent cells. Third, it's important to develop new methods for screening drugs. So with a virus like SARS-CoV-2, which doesn't infect mice, which are a useful animal model for developing drugs, we can develop new mouse models that can be infected with SARS-CoV-2 and then use those to screen new compounds. And finally, we can target the immune system to treat these causes of collateral damage, which include these cytokines that contribute to this inflammatory storm. Thank you so much, and we hope to see you at the next lecture where Bruce will be talking about the development of vaccines for COVID-19.